Black nurse ridiculed by doctors. Until she saves a patient considered impossible. Hey princess, how about checking that properly this time? Your technique is as sloppy as you look. Dr. Derek Matthews' voice echoed through the intensive care unit of Metropolitan Hospital, followed by laughter that cut through the air like blades. Jasmine Washington, 23, continued to methodically monitor the vital signs of the patient in bed 7, her eyes fixed on the comatose man who dominated the center of the unit. That patient had been there for 3 months, shrouded in uncertainty and grim prognosis like a monument to medical impotence disguised as scientific complexity. Seriously guys, Derek continued, adjusting his expensive stethoscope as his fellow doctors gathered like hyenas sniffing blood. Do you think she really understands what she's seeing, or is she just pretending to be interested to impress someone? Dr. Michael Chun, the senior supervisor, didn't even bother to hide his contempt. Matthews, don't be so cruel. She's probably never seen a complex neurological case outside of an episode of Grey's Anatomy. The others laughed even louder, as if this were the height of intellectual comedy. Dr. Brad Wilson, the head neurologist, approached with his smartphone held high. Hey guys, I'm recording this for our WhatsApp group. Title: The Nurse Tries to Understand Neurology. It'll go viral in the hospital. More laughter echoed through the ICU, each one piercing the dignity Jasmine maintained with superhuman effort. Why did a seemingly ordinary nurse observe neurological cases with such methodological intensity? Jasmine had worked at that hospital for 2 years, first as a nursing assistant alongside her mother, then alone when her mother suffered a stroke caused by the stress of enduring similar daily humiliations. The doctors at Metropolitan treated her like useful but invisible furniture when they didn't need her. What none of them knew was that she had grown up in her grandfather's neurological clinic, where complex diagnoses were unraveled through meticulous observation and refined clinical intuition. You know what the problem with this guy is? Derek asked, patting the chart condescendingly as if it were a defective pet. 3 million invested, the best specialists in the country have tried to wake him up, and he's still an expensive dead weight. Maybe the princess here has a revolutionary theory. Chun scoffed, crossing his arms. I bet she thinks the problem is a lack of maternal affection. The joke provoked laughter that reverberated off the ICU walls like echoes of institutionalized cruelty. How had a nurse with no apparent specialization developed knowledge of neurology that seemed to intimidate experienced doctors? Jasmine remembered her grandfather's words. Girl, patients are like broken engines. When something hurts, they scream. But only those who listen with their hearts can understand where the pain is. While those men with expensive degrees wasted 6-figure salaries on pompous theories, she had spent 2 years watching every failed attempt, every far-fetched solution, every elite specialist leave the ICU shaking their heads in defeat. She must be trying to decipher the medical notes, Wilson laughed, pointing to the neurological charts hanging on the wall. Poor thing, she probably doesn't even know how to interpret an electroencephalogram properly. Typical of those people. The pause before the word people was loaded with a venom that everyone understood perfectly. Jasmine felt her blood boil, but she kept her hands steady on the monitor, because sometimes silence is the most powerful weapon against ignorance armed with arrogance. Why did Jasmine always stay close to the patient in bed 7, even when she wasn't on duty? Hey Washington! Derek shouted, now using her last name as if it were an insult. Stop pretending you know anything and finish the monitoring. We have an important meeting with the medical board in an hour, and they can't see you there pretending to be a doctor. Faced with all the disdainful looks, Jasmine remained steadfast, like someone guarding a secret too powerful to be revealed before the right time. Because what those men in their white coats didn't know was that sometimes the solution to complex problems is right in front of your eyes, hidden behind the prejudice of those who refuse to see beyond their own limitations. What technical secret did Jasmine hide that could completely change the fate of the impossible patient? At that moment, watching the doctors laugh at her dedication to the patient, Jasmine felt a devastating mixture of anger and determination. Each humiliation only strengthened something inside her that her oppressors couldn't see, a silent determination fueled by the very injustice they tried to impose on her. If this story about prejudice and underestimation touched your heart, don't forget to subscribe to the channel to find out how a simple nurse would turn these doctors' arrogance into their greatest professional humiliation. Let her clean the administration bathroom too, Dr. Derek Matthews ordered on the phone, loud enough for Jasmine to hear from the hallway. If the princess wants to stick her nose where it doesn't belong, she might as well be useful. The following days turned into a systematic campaign of humiliation. Dr. Michael Chun began accidentally leaving spilled coffee cups at her station. Dr. Brad Wilson made a point of throwing crumpled papers on the floor whenever she walked by, whispering comments about people who don't know their place in medicine. "Hey, Washington!" Derek yelled on Tuesday, interrupting a case meeting. "Can you stop pretending to monitor and actually work? We have inspectors from the medical board visiting tomorrow, and they can't see this." He gestured toward her as if she were a defective object. Jennifer Walsh from Human Resources appeared with a stack of paperwork. "Jasmine, we've had some complaints about your behavior. Apparently you've been approaching medical equipment without authorization." Her voice dripped with fake concern. "You understand that this could be interpreted as attempted illegal practice of medicine?" Jasmine came home every night with sore knees from constantly checking on patients and a heart broken by the laughter that echoed through the hallways. Her small apartment in the suburbs felt like a fragile refuge from the storm of contempt she faced every day. There, surrounded by the neurology books she had inherited from her grandfather, she remembered the afternoons at the clinic when she was 12. "Brains don't lie, young lady," Dr. Samuel Washington used to say, his experienced hands guiding her through complex X-rays. "Men can lie, tests can lie, but the brain always tells the truth when you know how to listen." Those lessons seemed to echo through the Metropolitan ICU every time Jasmine looked at the patient in bed 7, while doctors debated complex theories and consulted 1,000-page manuals. She heard something they couldn't perceive, a neurological whisper begging for attention in places where no one else looked. "Just listen to this," Derek said during a staff meeting on Wednesday, gesturing dramatically. "Other departments have reported that our special nurse was seen yesterday leafing through neurological charts on the duty desk. Someone needs to explain to her that monitoring does not include diagnosis." Laughter spread through the room like wildfire. Chen shook his head in exaggerated disbelief. "Maybe she thinks she'll discover something that 15 trained neurologists couldn't figure out in 3 months. That kind of behavior is exactly what we'd expect from, well, you know," Walsh said, lowering his voice conspiratorially, "people who grew up without a proper educational structure. No sense of medical hierarchy." Jasmine remained invisible behind the glass door, organizing supplies while absorbing every poisonous word. What none of them knew was that she had spent her entire childhood in a family structure that would teach them more about neurology in one afternoon than they had learned in 4 years of expensive college. On Thursday, Wilson decided to create a new level of entertainment. "Guys, how about a quiz? Let's see if our nursing expert can identify at least 3 basic neurological signs." He pointed to different sections of the monitor like a condescending teacher. "I bet $50 she doesn't even know what a pupillary reflex is." Chin laughed, pulling his wallet out of his pocket. "100 that she confuses brain waves with heartbeats," Derek added, clearly enjoying the situation. Jasmine stopped monitoring and looked directly at them for the first time in days. Abnormal delta activity in the left frontal lobe, asymmetrical pupillary reflexes indicating intracranial pressure, and fragmented REM patterns suggesting suppressed conscious activity. Her voice cut through the silence like a knife. The ICU fell completely silent. The doctors looked at each other, clearly uncomfortable with the technical precision they had just heard from someone who supposedly didn't even know how to interpret basic tests. "Beginner's luck," Wilson stammered, quickly putting away his wallet. "Anyone can memorize a few technical words." Chin nervously suggested, "Maybe we should install security cameras in the ICU to protect sensitive equipment from inappropriate curiosity." On Friday, Derek decided to up the cruelty level. During lunch, when the ICU was empty, he set his phone to record and began his presentation. "Everyone come see this. Our nursing specialist is trying to diagnose the $3 million patient." Jasmine had approached the patient just to check his vital signs, but Derek narrated it as if she were practicing illegal medicine. "Look at her concentration. I bet she's calculating intracranial pressure based on the phase of the moon." The video instantly went viral in the internal medical staff group. Employees from other floors began making technical visits to the ICU just to see the improvised diagnostician in action. Even senior executives began commenting on the situation in Washington during meetings. "Did you see that hilarious video?" asked Amanda Foster, Chief Administrative Officer, during an executive meeting. "At least we know our nursing staff is interested in their work." But while everyone laughed, none of them realized what was really going on. Jasmine wasn't trying to diagnose at that moment. She was observing, cataloging, memorizing every detail that those experts had overlooked during 3 months of million-dollar failures. Each new humiliation only strengthened something inside her that her oppressors couldn't see, a silent determination fueled by the very injustice they tried to impose, like a brain being prepared to awaken at the exact moment no one expected. The weekend passed like an eternity. Jasmine relived every humiliation, every laugh, every look of contempt she received on Friday. But it was on Sunday, while organizing her grandfather's neurology books in his small apartment, that she found something that would change everything. A technical notebook that Dr. Samuel Washington had kept for 30 years as a neurologist. Complex neurological cases always have 3 causes, read one of the first pages. Trauma, inflammation, or compression. Complicated doctors forget that simple brains don't lie, people do. Her grandfather's words seemed to whisper directly into her ears like advice from beyond the grave. On Monday, Jasmine returned to work with a quiet determination that no one noticed. While Derek and his colleagues continued their cruel jokes, she began to observe the patient in bed 7 with completely different eyes, not as a curious nurse, but as Dr. Samuel Washington's granddaughter. "Hey, Princess," Chin shouted during the coffee break, "I hear you know how to identify neurological signs. How about impressing us again?" Laughter echoed through the ICU, but this time Jasmine noticed something different in their tone. There was defensiveness in their voices. That's when she realized something crucial. They were afraid that a mere nurse knew something they didn't. The joke about pupil reflexes had made them uncomfortable, and now they were trying to regain control through intensified humiliation. "You know what, Washington?" Wilson said, approaching her with his characteristic arrogance. "Since you seem so interested in our $3 million patient, how about we give you a real chance? We bet you can't even identify why he won't wake up." Derek clapped his hands as if he had a brilliant idea. "Yes. Let's make a bet. If she can point out the problem, each of us pays $500. If she fails," he paused dramatically, "she never sets foot in this ICU again." The proposal spread quickly throughout the floor. Within minutes, 15 employees gathered in the ICU to watch the nurse try to be a neurologist. Jennifer Walsh even brought popcorn, as if she were going to watch a comedy movie. "Take the challenge, expert," Chen taunted, clearly convinced that Jasmine would back down. "Or are you going to admit that all this confidence is just a facade?" Jasmine looked around the room full of smiling, expectant faces. Everyone there was convinced they were about to witness an epic humiliation. What none of them knew was that she had spent the entire weekend studying every scientific article she could find online about that specific type of neurological injury. "I accept," she said simply, her voice cutting through the noise of the side conversations. The silence that followed was broken by even louder laughter. "She really accepted," someone shouted from the back. "This is going to be better than Netflix." Then an unexpected voice cut through the laughter. "May I observe?" Everyone turned to see Dr. Thomas Reed, the retired neurologist who occasionally visited the hospital as a consultant. At 70, Reed was a legend in medicine, the man who had developed neurological protocols for 3 of the country's largest medical institutions. "Of course, Dr. Reed," Wilson said quickly, clearly nervous in the presence of someone so respected. "But it's just a joke. The nurse thinks she knows about neurology." Reed walked slowly toward Jasmine, his experienced eyes studying both her and the patient. "What is your name, young lady?" "Jasmine Washington, sir." "Washington," Reed repeated thoughtfully. "Are you related to the neurologist Samuel Washington who worked at Central Clinic?" Jasmine's heart nearly stopped. "He was my grandfather, sir. Did you know him?" A genuine smile spread across Reed's face. "Sam taught me more about neurology than any college professor. He was the best diagnostician I ever knew." He looked around the room full of surprised doctors. If you have half his talent, these guys are about to learn a valuable lesson. Derek and Chen exchanged glances, clearly uncomfortable with this unexpected revelation. The joke suddenly seemed less funny when a legendary neurologist was publicly validating Jasmine's medical pedigree. "So," Reed said, turning to Jasmine with genuine interest, "tell me what you see when you look at this patient." Jasmine approached the patient, her hands gently touching different monitoring points as her mind processed everything she had learned. The ICU fell silent, not with amusement, but with growing tension. For a moment, when she closed her eyes and placed her hand on the neurological monitor, Everyone thought they were witnessing just another theatrical performance. But anyone watching closely would have noticed that it wasn't acting that made those hands move with such precision. It was the contained power of someone who was about to completely rewrite the rules of the game. In that instant, Jasmine felt a deep connection to her grandfather's memory, as if all the neurological wisdom he had passed on to her was converging on this exact moment. It was a mixture of longing, determination, and a quiet confidence that came from years of invisible preparation finally finding its opportunity to manifest. Jasmine approached the patient with the precision of a surgeon. Her hands touched different monitoring points delicately as she whispered to herself, not out of nervousness, but because of the mental process Samuel Washington had taught her: listen first, then observe, then touch. "Did you hear what he's saying?" she asked, turning to the stunned crowd. "His brain has been trying to talk for 3 months. You just never bothered to listen." Dr. Derek Thompson felt a chill in his stomach. The confidence in Jasmine's voice was completely different from the shy nurse they had tortured for months. "She's bluffing," he muttered to Chun, but his voice betrayed his growing uncertainty. Jasmine knelt down near the neurological monitor and placed her ear close to a specific section. "Here," she said, pointing to a reading that looked identical to dozens of others. "Do you feel that subtle irregularity? That's the first problem." Dr. Thomas Reed approached, clearly intrigued. "Go on, young Washington." "Localized cerebral edema in the Broca's region," Jasmine said, moving to another section with growing confidence. "The brain was healing internally, but standard protocols never detected it because you only monitored the obvious areas of trauma." The silence in the ICU was deafening. Dr. Michael Chun fervently checked his smartphone, likely researching whether this made any medical sense. Dr. Brad Wilson stopped smiling completely, his face now tense with growing concern. "Second problem," Jasmine continued, pointing to an almost imperceptible medication on the list. "Sedative dosage calibrated for average body weight. You're treating a former athlete who has 40% more muscle mass than the standard. The medication is suppressing neural activity that should be emerging." Reed nodded slowly, his eyes shining with recognition. "Of course. How was it so obvious that we didn't consider that?" Jennifer Walsh whispered something to a colleague, clearly trying to process how a nurse without a graduate degree was diagnosing problems that 15 trained neurologists had failed to notice. Reality was beginning to crack the foundations of everything they believed about competence and medical hierarchy. "And the third problem," Jasmine said, walking over to a section of the monitoring equipment, "is where you really demonstrated systematic incompetence, if I may put it politely." Derek gulped. The word incompetence, coming from someone they had treated like human trash, hit him like a punch in the stomach. Jasmine pointed to a neurological control panel. "You installed a state-of-the-art monitoring system, but you forgot to calibrate it to the exact specifications for this type of injury. Result, it worked perfectly for 3 months, but you were reading completely wrong data." "That's impossible," stammered Wilson, clearly desperate. "We checked and double-checked all the systems hundreds of times." "You checked according to generic protocols," Jasmine replied with devastating calm. "My grandfather always said, protocols teach you about brains in general, but every brain is as unique as a person. You have to know their personality." Dr. Thomas Reed began to laugh, not in mockery, but with genuine admiration. Sam Washington was right, as always. "Young lady, you just solved in 15 minutes what cost this hospital $3 million in expert consulting." It was at that moment that reality hit Derek Thompson like a tsunami. The ignorant black nurse had just humiliated him professionally in front of the entire hospital. Worse, she had done so with medical competence superior to his own. "Can you prove that?" Chin asked, his voice trembling slightly. Jasmine smiled for the first time in months, not a submissive smile, but the confident smile of someone who was about to close the deal. "Dr. Reed, would you mind helping me? I need someone to monitor the neurological indicators while I make the adjustments." "It would be my pleasure, Miss Washington." For the next 20 minutes, Jasmine performed a series of precise adjustments while Reed watched the monitors. Each correction was accompanied by medical explanations that left the experts increasingly red with embarrassment. "Edema reduction progressing," Reed announced. "Neural activity increasing in all monitored regions. Drug response within ideal parameters." Jennifer Walsh tried to escape the ICU, but Reed intercepted her. "Ms. Walsh, I believe the hospital owes Ms. Washington a formal explanation as to how an employee with superior medical knowledge was relegated to basic nursing duties. Wilson began to sweat visibly. Dr. Reed, we didn't know she never showed, never demonstrated? Reed interrupted, his voice cutting like a razor. Or did you never deign to listen to someone you considered inferior? Derek tried one last desperate card. But she has no medical training. She has no specialized degree. Neither did my grandfather Samuel, Jasmine replied calmly, but he taught more neurologists at Johns Hopkins about diagnosis than any university. Knowledge doesn't come from a piece of paper, Dr. Thompson. Jasmine stood in front of the main control panel. Would anyone like to do the honors, or should I wake up a $3 million patient by myself? No one answered. The ICU had turned into a silent courtroom where the accusers were finding out who the real culprits were. When Jasmine initiated the wake-up protocol, the patient opened his eyes for the first time in 3 months. Not a vacant, sedated stare, but the conscious, focused gaze of someone finally free. The man whispered, "Thank you," looking directly at Jasmine, as the monitors confirmed normal neurological activity. The entire ICU witnessed a medical resurrection that would change everything forever. 3 months later, Jasmine Williams walked the halls of Johns Hopkins as a senior consulting neurologist, her badge gleaming under the fluorescent lights. Dr. Thomas Reed had kept his promise to introduce her to executives who immediately recognized the value of someone who could listen to brains in a way that expensive instruments couldn't. "Ms. Williams," said the director of neurology at Johns Hopkins during her first week, "your intuitive approach saved us $2 million in the first audit of complex cases alone. Would you like to head up our new preventive neurological diagnostics division?" Dr. Derek Thompson, on the other hand, discovered that competence was non-negotiable in the real world. After the awakening incident, an internal audit revealed that he had signed neurological reports without really understanding them, relying on his senior position to mask his incompetence. He was fired within 2 weeks. Dr. Michael Chen and Dr. Brad Wilson suffered similar fates. Chen was demoted to junior resident after it was discovered that his previous diagnoses had cost the hospital lives in unnecessary treatments. Wilson was transferred to a rural clinic in Montana, where he worked under constant supervision, a professional humiliation from which he would never recover. Jennifer Walsh desperately tried to delete the viral video she had created, but the internet is forever. Her career in human resources ended when other hospitals discovered her active participation in workplace racial discrimination. No reputable medical institution wanted to be associated with someone documented as humiliating talented professionals. The Metropolitan Hospital faced a federal audit over discriminatory practices after the case gained national notoriety. The hospital paid substantial fines and was required to implement diversity and inclusion programs, ironically having to hire consultants to teach them what Jasmine had always known: talent has no color. You know what the most ironic part is? Dr. Thomas Reed said during a celebratory dinner 6 months later. Your grandfather Samuel taught me more about neurology in one afternoon in 1985 than these guys learned in 4 years of college. Jasmine smiled, touching the necklace that held a photo of Samuel Williams. He always said that brains are like people, you have to treat them with respect to get the best out of them. Amanda Foster, who once laughed at the hilarious video, now worked as a receptionist at a veterinary clinic. Her MBA was worth less than the common sense she never developed. During an unsuccessful job interview, a recruiter mentioned, "We saw the video where you humiliate a professional. You're not the kind of person we hire." The patient in bed 7 had made a full recovery and returned to normal life. A discreet plaque next to where his bed had stood now read, "Diagnosed by Jasmine Williams, intuitive neurologist." It was a small but powerful acknowledgement. Derek Thompson now worked as a lab technician in the suburbs, where he ironically had to learn the hard way what Jasmine had always known, that true knowledge comes from the hands and the heart, not from diplomas. His supervisor, a veteran technician who had never set foot in a medical school, constantly corrected his basic mistakes. "Your grandmother would be proud of you," Dr. Reed said during a conference where Jasmine was presenting her techniques to hundreds of neurologists. "You have proven that wisdom is priceless, but ignorance always comes at a high price." Jasmine's lecture went viral for reasons completely different from the previous video. This time, millions watched a young black woman teach doctors from prestigious universities about the importance of humility, observation, and respect, values that no degree can convey. Chin tried to enroll in one of her online courses, but was rejected. Limited spots for qualified professionals, the automated email said. A delicious irony, considering who now defined qualified. Jasmine's true revenge was not to destroy the careers of others, but to build something greater than her oppressors could ever imagine. She turned humiliation into motivation, prejudice into purpose, and the incompetence of others into her own opportunity. Do you know what my biggest mistake was? Derek confessed to a former colleague months later. I thought a degree was worth more than knowledge. Now I work for people who know more than me without ever having set foot in medical school. Jasmine Williams proved that real medicine isn't about memorizing protocols, but about the ability to listen, observe, and respect both patients and people. And that sometimes the best revenge is simply to be better than those who tried to bring you down. During a national interview, Jasmine was asked what motivated her most. My grandfather always said that every brain has a story to tell. My job is just to teach other doctors to listen to those stories with their hearts, not just with equipment. The medical system had learned a valuable lesson. True competence transcends prejudice, and wisdom can come from the most unexpected places when we are humble enough to recognize it. If this story of transformation and justice touched your heart, don't forget to subscribe to the channel for more stories that prove that true talent always finds its way, regardless of the obstacles that prejudice and arrogance try to impose.